Bim. Guess what? We're back for another live stream of a COVID briefing from 10 Downing Street. Old Boris is about to have done something to my throat today. I ate something and it scratched my throat. Anyway, let's not let that worry me. Boris is going to tell us that things have gone to poop and he needs to do something about it. Yeah, no poo Sherlock. I've been telling you this for weeks. So it looks like a lot of people are going into tier 4. Which is not exciting. Basically, it's another way of saying lockdown, only without using the word lockdown, although we'll all refer to it as lockdown, like they already are in London. Even though it's tier 4 in London, they're calling it London lockdown. So tier 4 is lockdown. No getting away from it. It is lockdown. So, what are we going to do? Well, this is what we should do. Whether it says it or not is another thing. We should have done this before Christmas. We should do this until at least the middle of February. Better still the end of February. Reasoning for that. The hospitals every winter get absolutely overloaded with patients. And that's even before COVID was a thing. Right, so that was before COVID was a thing. The hospitals get overloaded at winter time with slips, trips, falls, people getting flu, and all the usual stuff that winter brings. And obviously the NHS has got an added issue at the moment, which is of course the COVID. So what we're going to do? What we're going to do is we're going to shut everywhere down until the middle or the end of February. By then, it should also reduce the amount of people going in with flu, because if everyone's self-isolating or staying at home or not going to work or not going to the shops or whatever, it's going to reduce all things, not just COVID, which gives the NHS a chance to cope with what they're going to get over the next month from people who messed around in Christmas time, because it's just going to get worse before it gets better. So we've got to think ahead. You've got to think in 4-week chunks. So, and people are living longer now because when you get the COVID, they didn't know what to do in March, but now they know how to treat it better. So people are surviving longer, which is great, but it means they're staying in the beds longer, which is not so great. So we need to take the pressure off the NHS. So if I have a heart attack or get hit by a car, or you or your family, anything happens to your family, they can go to hospital and they can get treated promptly for whatever condition they've got. If it's COVID, or if it is, like I say, stroke, heart attack, accidents, diabetic coma, whatever, you need to get in the hospital quick. So there's no beds. There'll be no beds left by the end of January. So we give it until February, either middle or end of February, and then what happens is we lift it and put it back to where we were. So hopefully by March things will have gone up again, but by the time we get to March, they will slow down, and then it will start going down again as summer comes along, as we found out last summer. And then it'll only come back proper in October, November, all being well. And the point of that is, by then, hopefully, everyone who needs the injections, i.e. the elderly, the vulnerable, the people with underlying health issues, key workers, blah, 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 will have had the injection. It doesn't matter about the rest of the people, just them. And once we've done that, then we don't need lockdowns anymore, because all we need to do is just wear the face masks and everything, and then the people who do get ill, which hopefully people who won't end up in hospital, who can cope with the illness, will take the pressure off the hospital, so next winter we'll be better prepared. That's what I'd do. However, I'm not Prime Minister. So we'll see what Boris says. He was due on a minute ago. 50,000 new cases, 981 deaths. So we're waiting for Boris to come out. So that's what I'd do anyway if I was in charge. And I mean, I know people who work at the hospital, and I know people who work at other hospitals, and they're all saying the same things. It is getting dangerous in the hospitals, and we've not had what people did at Christmas, and we all know people who went places that shouldn't have gone. We all know people who went to houses that they shouldn't have gone to because they've already been to someone else's house. So we all know there's another spike coming in 2 weeks for people being diagnosed with it, and then 4 weeks of people actually ending up in hospital with it. So we're just waiting for Boris. Oh, I'm lagging now, great. DC, it doesn't matter whether people are dying from COVID or not. What matters is there are people in hospital with COVID who are stopping people who need cancer treatment, who need operations, who need treatment for heart attacks, strokes, getting in. Oh, we're off. We're off. So waffle, waffle, Boris, Boris, waffle, waffle.
Good afternoon, everybody. Today I want to begin with the good news, the approval of the Oxford AstraZeneca vaccine, which is a fantastic achievement for British science and which will allow us to vaccinate more people and also vaccinate them more quickly. And there's one important development that's helping us to accelerate our vaccination programme across the whole of the UK. We've had new advice from the Joint Committee on Vaccination and Immunisation that the first dose can protect people against the worst effects of this virus because the benefits kick in after 2 or 3 weeks. And so from now on, we will give a first dose to as many vulnerable people as possible, with the second dose to follow 12 weeks later. And what that means is we can vaccinate and protect many more people in the coming weeks. I know that everyone watching this will want to know when you can get your vaccine. And all I want to say is that we are working as hard and as fast as we can to get the supplies to you. And as soon as we have the supplies, we'll be getting them into people's arms. To summarise where we are, we have to face the fact that we've got two big things happening at once in our fight against COVID. One's working for us and one working against us. On the plus side, we've got two valid vaccines, and
this
we're
is a
racing,
shit
as I
sandwich,
say,
isn't it?
to get them out. On the downside, there is a new strain of the virus which is spreading much faster and surging across the country, and we've seen a 40% increase in cases in England in the last week alone. Almost 15% more patients in hospital.
He's
more
just
than
turned
the
up.
peak
He's late.
of the first wave. And yesterday, sadly, we recorded almost 1,000 deaths across the UK for the first time since April.
Oh, good. Boris is
So
here.
at this critical moment, with the prospect of freedom within reach, we've got to redouble our efforts to contain the virus. And that's why the Health Secretary has announced that more areas of England will be moving into Tier 4 from tomorrow. And I say again, no one regrets these measures more bitterly than I do, but we must take firm action now.
We should have done this
And
a
that's
week
why
ago.
we have to think very hard about schools, because today, of course, it remains the case that keeping children in education is a national priority, and it remains the case that schools are safe. But we must face the reality that the sheer pace of the spread of this new variant requires us now to take even tougher action in some areas, and that does affect schools. And let me set out for you what this means. In most of England, primary schools will still reassemble next week as planned for the new term. But in the areas we've just published today on gov.uk, I'm afraid the start of the new term will be delayed until at least January the 18th, when the latest data on those infection rates will be reviewed. And that is because the rate of transmission in these areas is so high, and there's just such pressure on the local NHS that extra action is required to control the spread of the virus.
Yeah, you could do with schools.
The children of key workers or those who are considered
Dead
to
easy,
be vulnerable
right? This
will
is the easiest thing in the world to
go
do.
back to primary
We've got
schools
digital
from
TV.
next week, wherever
Everyone's
they
got
live
digital
in
TV.
England.
You don't have to have the
They
internet
are
for
not
digital
affected
TV.
by
We've all got
today's
digital
announcement.
TV. Bog standard
In
Freeview.
secondary schools, all
Why not
vulnerable
have
children and the
A
children of
channel
key workers
designated
will go
to
back
each
next week
year at
across England
school
as
that
originally
broadcast
planned.
every day
But we will
from
ask
9 o'clock
exam
till
year
12 o'clock,
pupils
from
in
1 o'clock till
secondary
3
schools
o'clock,
to learn
whatever
remotely during
their
the first week of
thing is
term
they should be learning
and
in
return
that
to the
year.
classroom from
And then
the
everyone
11th
can
of
watch it. They
January.
can all have notebooks and
The
things. You
remaining
don't need the internet. You don't
secondary
need
school
PCs. You
pupils,
don't need anything else. We've
non-exam
got so many
groups
empty
will
channels
go back
that
a
are
week
easily
later.
fillable.
That is from
And you only
the
need 1 or
18th
2
of
teachers
January.
per each year to actually
But
do
I
that
want
per
to
time.
stress that
Simple.
depending
I
on the
could do it
spread
from
of the
here.
disease,
I mean, come
it
on.
may be necessary to take further action in their cases
it's
as well.
a bow tie.
In,
It's not a light,
as
it's a
I
bow
say,
tie.
the worst affected areas. To minimise disruption in schools and to fight the disease, we're massively expanding our testing operation, ensuring that every secondary school pupil is tested as they return and regularly thereafter. I, again, want to thank teachers, pupils, parents who've worked so hard to keep schools safe and keep them open. We're also asking universities to reduce the number of students who return to campus in January, prioritising medical courses and others requiring face-to-face teaching. And in all cases, students should be offered 2 rapid tests when they return. All of these measures are in the end designed to save lives and to protect the NHS. And for that very reason, I must ask you to follow the rules where you live tomorrow night and see in the new year safely at home. That means
It's
not
not gonna
meeting
happen.
up with friends or family
Not gonna
indoors unless they're in the same household or support bubble, and avoiding large gatherings of any kind. We are still in the tunnel of this pandemic. The light,
Analogy.
however, is not merely visible. Thanks to an extraordinary feat of British engineering, if you like, the tunnel has been shortened, or we're moving faster through it. And that gives...
But if we don't
me
behave
great
ourselves, we're
confidence
going to have a
about
rock slide and we
the
won't be able to
future in
see
this
the entrance
country.
of the tunnel until we dig
for
our way
now,
out again.
Let's redouble our efforts. Let's follow the rules, protect our NHS, and together make 2021 a year in which we leave this tunnel behind us. I'm now going to hand over to Jonathan Van Tam to go
Hey!
through
Mr. Analogy. Welcome
Thank
back.
you, Prime Minister. I'm going to now deliver the data briefing to you. And I would first of all say that always remember, please, that infections happen and then they are reflected in the statistics several days later when people come forwards for testing. They're always out of date by a few days, in other words. On top of that, Christmas is always a difficult time to assemble stable statistics. So please bear
Like I
both
explained
of
in
those
the
points
shop
in
today.
mind. First slide, please. You can see here 2 pictures of the UK, one based on the 10th of December and one based on the 24th of December. And you can see that the average case rate per 100,000 through testing is 190 per 100,000 on the left, rising to 380 per 100,000 as a UK average by Christmas Eve. The heat maps on the geographic representation, the darkest areas are the hottest areas, and you can see overall there's been a considerable growth across the national footprint in that time, and particularly centred on London, the South East and the home counties, and also South Wales. Next slide, please.
To be fair, Wales looks pretty stable because
This is
they're in
now being
lockdown already.
reflected in the number of people going into hospital with COVID-19 across the UK. On the extreme left, you can see Scotland, Northern Ireland and Wales, and then you can see the English regions on the right of the slide. And I really want to draw your eye to the 3 in the bottom right-hand corner, the South East, London and the East of England, where you can see very sharp rises that have really taken off since early December, but particularly so in London in the last few days. With regard to the Midlands, the Northwest and Northeast Yorkshire, you can see that things are not running quite as hot as they were in early November.
But we don't want
They've
them to.
come
That's
down
the
a
whole
bit,
point.
but they have not really, they've stabilised at a high rate. They have not dropped low. So that's equally a problem that we face now. Next slide, please. Data from the Office for National Statistics
DC.
show you here from the surveys the estimated number of people testing positive in England over time, from typically at the start of the autumn 1 in 900 people testing positive, to a point just before Christmas where nationally in England 1 in 70 people were testing positive. And you can see the effect of the national restrictions bringing the curve down in the period between 6th November and 5th December, but then unfortunately you can see the sharp takeoff after that that is all too familiar to all of us now. A little word on this slide on the new variant coronavirus, which has been reported widely in the media. Testing that is compatible with identification of the new variant are the dark blue lines, and the other variants, or the old or the pre-existing variants if you like, are the brown lines. And what you can see is in that bottom right hand corner again, where I drew your attention to those very sharp rises in hospital admissions, you can see that in terms of the percentage testing positive for the virus, the percentage testing positive with the new variant is increasing at really a very substantial rate indeed.
That's going to happen to all of us very soon.
In the other areas, or
That's
most
scary.
of the other areas, I unfortunately have to say to you that I think to the right-hand side of each chart, with not much more than the eye of faith, you can see those upticks of the new variant beginning to occur. And that obviously is of enormous concern, that the new variant, with its increased transmissibility, is beginning to spread to other areas of the UK. Final slide, please. This slide really geographically summarises where we are in terms of the tier restrictions being announced today. A very large proportion of the UK, 78% of the population, are as of tomorrow being placed into tier 4, with a small minority remaining in tier 3 and almost nowhere now left in tier 2.
So it's a national lockdown.
Tier 1. So you can see, unfortunately, it is.
If you can see Merseyside there,
pretty grim and
surrounded by
picture
tier 4.
at the moment.
Everyone is going to go to
The
Merseyside to go
situation in
shopping.
the UK
They won't be able to go to
precarious
restaurants
in
and
many
pubs because
parts
restaurants and
already,
pubs will be shut.
particularly
But everyone is going to go to
southeast of
Liverpool
London.
and Yorkshire,
And
and that's going to. This
It
is
all
where the
certainly
tiers
true
don't
that
work.
The NHS has not yet seen the impact
This is going to
of the
be
infections
really bad.
that will have occurred during mixing on Christmas Day. And that, unfortunately, is also rather sobering. So given that picture, I just want to say, look...
Why can't
I
we be
know
ahead of this
New
rather
Year
than react
is
to it?
coming
I don't
up.
understand.
I know it's normally a time of great festivity and enjoyment, but you have just got to play your part now in bringing us back from this very dangerous situation that we find ourselves in. I will stop there, Prime Minister, on the epidemiology.
Thanks very much, Jonathan. That's very helpful. Steve, anything you want to add from the perspective of the NHS?
Yes, thank you, Prime Minister. And as the Prime Minister has said, and as JVT has shown you in the slides, high infection rates from COVID are causing significant pressure on the NHS. And that is particularly the case in those parts of the country where the new variant has arisen. And that's led to a rapid rise in infection rates and, again, as JVT has shown you, unfortunately, a high number of hospital admissions, and that's particularly London, the southeast and the east of England. So I'd like to start tonight by paying a huge tribute to all our NHS staff throughout the country. They have worked incredibly hard over this year managing patients from this pandemic, and over the festive period they have had to work even harder, particularly, as I've said, in those areas which are seeing those high infection rates with the new variant. They have absolutely gone the extra mile. In fact, they have gone many, many extra miles over the course of the year. And as JVC again has said, it will continue to be tough over the next few weeks. But of course, everybody is able to help the NHS and to assist our incredible staff and play their own parts. As both the Prime Minister and Jonathan have said, we know it's the end of the year. It's a time where people traditionally want to celebrate, but it's absolutely
Who wants to
vital
celebrate
that
this year?
Everybody continues to follow the guidance by staying at home and not mixing. My colleagues, as I've said, up and down the country, continue to work hard with record
No, they'll
numbers of
just borrow
patients
money
with
for that.
COVID, and of course, keeping vital services such as cancer treatment and accident emergency departments open at the same time for people who don't have COVID. So we can all play our part in fighting this terrible virus, stay at home, mark the new year with just nearest and dearest within the rules. This action will reduce infections, relieve pressures on hospitals, and that's how everybody can help to save a life. COVID loves a crowd, so please leave the parties for later in the year. Prime Minister.
Thanks very, very much,
COVID
Steve.
loves a crowd. I like
I'm
that
sure
one.
everybody will echo what you have just said about our wonderful NHS care workers, everybody keeping people safe this winter. Let's go to questions from the public and sorry, yes, of course, JBT. Would you say something about the vaccine? Thank you.
Yes. So it's not all bad news from my corner of the room. It's actually also a very good news day with the authorisation of the Oxford AstraZeneca vaccine. And I want to really thank the scientists who've worked night and day for the last year getting this vaccine together, and also thank the doctors and nurses of the National Institute for Health Research, the NIHR, without whom this whole trials programme could not have come together in the way it has. So, we have MHRA conditions for the new vaccine, authorised, very standard conditions, quite what you'd expect for any new vaccine. The JCVI has made an announcement that the vaccine should be pressed into service immediately alongside the Pfizer vaccine.
Don't be
The
pressing anything.
JCVI's view is that these are two good vaccines with no major distinctions between them. Now, I want to caution everybody, particularly the media, about over forensic examination of percentage vaccine effectiveness. It's really important to remember that the definition of illness in the Pfizer and the AstraZeneca programs were different, so they were slightly different endpoints, so you can't really compare them. But what really matters to us is not an endpoint that measures illness, but how these vaccines are going to impact on severe disease, on hospitalisations and on deaths. And I'm confident, and I think the JCVI are also very confident, that both of these vaccines will do that. There is already some preliminary data from the AstraZeneca programme. There have been just 2 hospitalisations in the whole of the clinical trials programme in patients who received the vaccine. One hospitalisation occurred 2 days after the vaccine was given, so you can easily work out that the infection occurred before the vaccine was actually administered. And the second one occurred 10 days after the vaccine was given. And again, 10 days is not long enough for a vaccine to work. Optimistically, you'd say 7 to 10 days you might get some effect, but far more typically, it's 14 to 21 days.
And if you do get the
vaccine is going to kick in.
Virus,
So they weren't really
going to
vaccine
take
preventable hospitalisations.
You've already got it.
And
If
this
it,
is very,
you
very
get hospitalised in
encouraging,
10 days,
albeit
because it
preliminary
takes
data.
2 weeks from
The other
getting
really
it
big
to actually
thing
getting
that
hospitalised.
JCVI
So
has
give them that.
changed for us in the last 24 hours is this very clear advice to prioritise the first dose to as many people as possible. This makes enormous sense to me as somebody who's public health trained, and I'll try and explain why. Firstly, the JCVI are very confident that there are high levels of protection from both vaccines after the first dose. Secondly, the MHRA has given the operational flexibility around the interval between the doses so that operationally there is room for manoeuvre now. The second dose of both vaccines is integral. It remains important for longer term protection, but the priority is the first dose. And so what does that mean in terms of, how's this strategy been put together? I want to try and help people understand that.
Oh, analogy.
And basically, you take what you've got,
Yeah.
you work out what you're going to get, you look
Not
at
a
the
lot.
epidemiological situation in front of you, and then the scientists and the modelers from the JCVI put all that together and they say, how do we get the maximum benefit
Oh,
for the most people in the shortest possible time? And that's the approach they've chosen, and it has been strongly endorsed by all 4 chief medical officers of the United Kingdom. Thank you, Prime Minister.
Thanks very much.
Oh, no
JVT.
analogy.
Let's go to questions from the public and from the media. First, Cameron in Buckinghamshire.
hi
There are
Cameron.
reports the Tier 4 restrictions may be in place until the spring.
Think
With
he
so many
works for that
businesses on their
brewery.
knees, what assurances can you give that this won't be the case and businesses can look to reopen in the new year?
Well, Cameron, thanks very much. You'll have heard about the measures we're sadly having to put into place
It's
across
not there.
many parts of the country.
It's pre-recorded, so
Tier
we can't
4
swear at you.
Or Tier 3. We want to get those areas out as fast as we can, but the data at the moment simply doesn't allow it. The spread of the new variant simply doesn't give us the scope to do that. I think there will obviously come a point when we've made so much progress with the vaccine and also with tough tiering that there will be different options.
February,
We
middle
hope
of
that comes
February,
as fast as possible.
end of February.
I
Any
think
earlier than that,
um,
it's a disaster. Unfortunately.
We've heard previously from Chris Whitty and others that April the 5th, Easter, we really are confident that things will be very, very much better, and obviously we'll try and bring that date forward as fast as we can. And that's why the vaccine rollout programme is so important, and what JVT had to say just now about accelerating that rollout programme with using the first dose on as many people as possible is encouraging. But is there anything either would like to add to that one? Ivy, thank you very much. Let's go to Jonathan from South London. And this is Jonathan asks, given the high rates of COVID infections and hospital admissions, why has the government decided not to reopen the Nightingale hospitals? Well, actually, as far as I know, Jonathan, I can tell you, we are going to be making sure that the Nightingale hospitals are available. They are certainly are available, but they're there not to be used immediately as long as the other provision is still there. But Steve, I know you've been working with
DC,
them closely.
Yes,
China
thank you, Jonathan.
had a strict
So the
lockdown where you
Nightingale
weren't allowed
hospitals
out your
have
apartments,
obviously
and
been
if you
there
were,
over the
you got
course of the year.
arrested.
They are our insurance
That's how they
policy.
did it. With
They're
Britons
our
wouldn't
last
do that.
resort. And indeed, we asked
China's
all the
a different
Nightingale
thing, and the
hospitals,
people are very
a few
submissive in
weeks ago
China.
to be ready to take patients if that was required. And indeed, some of them are already doing that in Manchester, taking step-down patients, in Exeter, managing COVID patients, and in other places, managing diagnostics, for instance, and diagnostic services. What we've learnt over the year is that we can use the Nightingales for a variety
That
of
said,
purposes,
China's
as
back
I-
in the middle of a
I just
crisis again
explained.
with
So
this.
we will be keeping those purposes under review. Our first steps, though, in managing the extra demands on the NHS are to expand capacity within existing hospitals. That's the best way to use our staff. And then, if needed, we can also put in place mutual aid between hospitals and healthcare organisations. That's exactly what's happening in London, the South East and East of England as we speak. But as the Prime Minister has said, it's critical that those Nightingale hospitals are there if they are needed.
Thanks, Steve. Let's go to the media.
Oh, he's twitching. He's got a twitch.
Prime Minister, how many people will the NHS immunise every week? Because surely it needs to be in the millions.
Well, thanks very much, Fergus.
I think the problem is that we can't get millions of them.
At the moment is that we will have millions of doses, tens of millions of doses by the end of March. We're working to get the programme going as fast as we can. I don't want to give you specific numbers at the moment, but I can tell you that we are shifting heaven and earth to roll them out as fast as we can. I know that JVT, you've also been asked about this today. Is there anything you want to add on that?
I would add that actually it's probably not the best idea to look at December and how the NHS vaccination programme has started with the Pfizer vaccine and try and overlay that on kind of kitchen table mathematics for how that's going to scale up through January, February and March. There's a real game changer here in terms of the thermostability of the AZ vaccine being handleable at 2 to 8 degrees centigrade all the way through, none of this ultra low temperature, none of the thawing, and a months long stability at 2 to 8 that is going to give us all sorts of reach and flexibility and scale up. In addition to that, there is an absolute ambition across the whole of the system that the only thing that is going to slow us down is batches of vaccine becoming available. And many of you know already that it's not just about vaccine manufacture, it's about fill and finish, which is a critically short resource across the globe, always has been.
It's Philistine Phil's brother.
And then there is individual batch release,
fill and finish,
which is a safety and quality requirement that absolutely has to take place. But I suspect Steve Powis can give you a bit more detail about how the NHS plans to scale up.
I think he's having a twitching
and how the primary
session.
care networks, for example, are raring to come on board.
Yes, thanks, Fergus. So as you know, we have been preparing for many months within the NHS to start this massive vaccination programme, the largest the NHS has ever undertaken, and we started that in December with the Pfizer vaccine rollout, which we knew would be based on limited supplies as we go towards the end of the year. And as you know, as of last Sunday, over 500,000 people had been vaccinated in the first few weeks. We now have the good news that the AstraZeneca vaccine has been approved, and our intention is to start rolling that out through hospital hubs and primary care networks beginning on the 4th of January, in other words, next Monday. And that will lead to a big expansion in the number of people who are vaccinated. And of course, with the other news that we are now permitted to space the second dose, as JVT has implied, explained, that also means that we can get on and vaccinate more people. So our aim is to get the jab into people's arms as quickly as the manufacturers can supply that vaccine to us. We've been focusing, as you know, on the highest priority groups set by JCVI, so the over 80s, residents in care homes, care home workers, and to avoid wastage, we've also been vaccinating NHS staff. But the increased supply that comes with the AstraZeneca vaccine means that we have written out to healthcare organisations today to instruct them to immediately expand the vaccination programme to all frontline health and social care workers. And as vaccine supplies increase over the next few months, then we will be working to deploy through the next set of priority groups that JCVI have identified.
Brilliant. Thanks, Steve. Let's go. Thanks, Fergus. Let's go to Sam Coates of Sky.
Prime Minister, moments ago you quoted Chris Whitty saying that things will be much better by Easter, possibly April the 5th. Can you just spell it out? What does much better actually mean? People back in offices, seeing friends in gardens or their homes, holidays, or is that all over-optimistic, and should we expect those things to take till the summer or later? And there's a very specific one on schools. If you're a parent of a primary child in a Tier 4 area, but your school is reopening next week, are you still legally obliged to send them if you're worried about infection rates? Professor Van Tam, a practical question. If somebody has the vaccine, can they see their grandchildren, for instance, as soon as the second dose is effective? Or are you still going to enforce the law banning them from travelling, meeting and going into one another's houses, even though for that person it's safe to do so? And finally, Stephen Powis, there are unnerving pictures of ambulances queuing outside hospitals. Could you just characterise...
Everyone else has asked one question. He's asked 5. So I don't watch Sky News.
Does it feel overstretched in parts? And would you expect specifically the London Nightingale, where things seem to be so bad, to be needed anytime soon?
Yeah, thanks very, very much, Sam. Look, just my message, first of all, on schools, message for all parents except in the school areas which have been specifically identified as being where the epidemic is really surging the most, and where we do, alas, want to postpone primary schools until the 18th.
I think by better he means that the pubs might be open and the restaurants might be open.
Teachers, school authorities, parents,
but we'll be wearing masks
to
and
make
we'll be using hands, face and space.
The issue is what happens
12
months, the
spread 2 years longer
from the mixing.
It's not going to go back to normal anytime
takes
soon.
Place in schools. That's what we're trying to combat in the very high infection rate areas. So my message would be, unless your area specifically is identified as being amongst those very, very high infection rate areas, send your children, send your family to school in the normal way. Absolutely right to do. And on what's the world going to look like? How do we define success in the spring? Well, if we're right, if the vaccination program does have the positive effects that we think it can have, and I stress these are ifs, then clearly a lot of the non-pharmaceutical interventions, the closures of hospitality and so forth, all those will recede into the past, and we'll be able to do things very, very differently. That's the hope. Those, I think, Jonathan and I have discussed previously in these occasions. There may be things that we want to carry on in order to protect ourselves, basic disciplines about washing hands and so on. I think JVT mentioned wearing masks. There may be things that we want to continue with to protect ourselves against the virus for a while to come. But the hope is basically that we'll be able to move beyond NPIs if, as I say, the vaccine rollout program is effective.
Yes, so indeed, that there may be things that individuals decide that they've formed habits that they're going to stick with. That's to be seen in the future. Your question to me was rather more about vaccines and behaviour, and if after the second dose of your vaccine it's okay to behave with wild abandon and go off to the bingo halls and whatever you like and so forth. The answer to that is in 2 parts, but the magic phrase is transmission. I think we can be confident, and we will know quite quickly, within a matter of a couple of months, the impact of these vaccines on reducing severe illness in the population. And when we know that, we'll be able to say, when you're fully vaccinated, I hope we'll be able to say your chances of severe illness from COVID are very markedly reduced. But right now, we can't say that that is synonymous with you not being able to pass the vaccine, the virus onto others. In other words, we don't know if the vaccines will reduce transmission yet. We definitely will be looking at that. Public Health England have their finger on the pulse on this one through the Siren study, in particular, looking at healthcare workers who will be vaccinated and where they're being tested for symptomatic and asymptomatic illness on a regular basis. So we'll get a handle quite soon, I hope, on whether these vaccines reduce transmission. But until then, even if you're vaccinated, I can't assure you that you won't. I can assure you that it's very likely you'll be protected from severe illness, but I can't give you the assurance that you won't still pose a hazard to others through transmitting the virus.
Yeah, because it lives in your nose and your throat.
On this point,
but
give it another 2 or 3 months.
If it gets into your bloodstream, that's when it gets to your lungs.
Again, and I hope I'll give you a much more reassuring answer.
If the
Thanks very
antibodies
much,
are in the bloodstream.
Let's go to Charlotte Ivers. Oh, so sorry, Steve.
Yes.
Sorry, forgive me.
Just to go to Sam's question on NHS pressures. So I think, as we've all commented, the NHS is under significant pressure.
So you might be able to cough it and sneeze it out, but you won't actually get it yourself because it gets into your bloodstream.
Of countries such as London, as you've noted, where we've seen rapid rises in infections, predominantly because of the new variant of COVID. So the NHS in London, as indeed it does around the country, has tried and tested plans in place to manage surges in activity, and of course those have been refined further during the year as we've learned from the first wave of COVID. Those plans are being implemented as we speak. They involve, again, as I've said, firstly expanding capacity within existing hospitals, ensuring that mutual aid is in place between different healthcare organisations, so patient, staff, sometimes equipment can be moved around, and that's the right thing to do clinically because it's the best way of managing patients. Again, the Nightingale in London is being readied, and if it is required, then we will use it. But the first step is capacity within existing hospitals. But I think it's really important for me to emphasise, as I've said already tonight, that the real key to reducing pressure on the NHS is if everybody complies with the social distancing measures that are in place. It's only by reducing infection rates that a couple of weeks later we will start to see a similar reduction in hospitalisations and the number of people in hospital. So it's really critical that everybody does what actually we've all been doing throughout the year, no matter how tough it is, and stick with those restrictions. Hospitals might seem a distance away if you're well, but actually it's your actions in potentially not transmitting this to somebody else that further down the line can save somebody's life. That's been the case throughout this pandemic, and it's really, really the case this period at the end of the year when we are seeing infection rates at their highest.
Thanks, Steve. Thanks, Sam. Charlotte Ivers, Talk Radio.
Thank you, Prime Minister. You stressed the need for speed in the rollout of the vaccine. So I got a bit of a Tiggerish question for you. Could you ever envisage a 24/7 rollout of the vaccine? That's what a lot of our listeners have been asking about, or something similar to that, if not.
Charlotte, well, I mean, I can tell you that people are working around the clock to get this done. But I think I'll hand over to Steve and JVT to talk about the modalities. Steve.
Yeah, so as I've said, we are working in the NHS to roll things out as quickly as possible. We need the supplies to come through from manufacturers, and maybe JVT could say a little bit more around how that process works and the importance of batch releases. These are still unlicensed products. Remember, they have emergency authorization, and so it's important that we do this properly by the book, but we are going as quickly as we possibly can. JVT?
Yeah, thank you, Steve. I mean, vaccine delivery is very much an operational matter
I think
for
he's
the
just
NHS,
thrown JVT under the bus there.
My exhortation to the whole of the system is that we must go as fast as the speed of supplies. In other words, as fast as the batches are landed and are batch released, we should be using them. There shouldn't be any stock held in a room somewhere or a fridge somewhere waiting to go out. It should go out as soon as it can. We have to have that ambition.
But Charlotte, your question is incredibly important, and obviously we're looking at the whole time. The rate limiting factor, as they say at the moment, is supply and not distribution. I think it would be fair to say. Let's go to that will be is being stepped up rapidly as well. Let's go to Mesa Hall of the Express.
No.
Thank you very much, Prime Minister. The extension of restrictions announced today will mean many more businesses have to close their doors. Can we as a country
I wonder how
afford to
many
keep
times
borrowing to
he's
support
written the
those
front
firms
page
and
of the
their
Daily Express
employees?
headlines.
And should we expect any new measures from the Chancellor, given that so many of us are now effectively back in lockdown in all but name?
Thanks very much, Mesa. And obviously, we deeply regret the necessity to impose these restrictions on ordinary life, on businesses. I know
hi,
how
Penny.
tough
Hi,
it has been
T-Bone.
for people for so long, and how
yeah,
tough
we're
it
in
is
4 now.
In Tier 4 for hospitality, for retail, and that's why, of course, Rishi Sunak, the Chancellor, extended furlough right the way through to April. And end of April, and also why we have the many varieties of support loans, grants that you'll be familiar with, Mesa. Those will remain there. But the key thing is, as everybody has said this afternoon, to work together to follow the guidance, get the virus down, but also to roll out that vaccine. And I know how
got 2 more weeks
the
off
most
there.
interesting slides today were those ones that showed the difference between the new variant and the old variant. And the kind of the sad thing is that you could see how the efforts of the British public were working in getting the old variant under control. And then you could see the way this new variant has just started to spike. The way to beat that is with the vaccine and the rollout, and obviously, as several of your colleagues have rightly said this afternoon, we're going
2
as
weeks
fast
extra
as we can to do that. Should we go to Richard Vaughan of the Eye?
Hello there. A quick one for the scientists and then one for you, if possible, PM. How concerned are you about failed inoculations due to the rising infection COVID rate? You said there's a gap between having the jab and developing immunity. Do you expect the efficacy to drop? And given what you said about schools, should we start inoculating school pupils? And just one finally for you, Prime Minister. You said that, the Brexit deal was passed today, and the new vaccine is going to be rolled out. On a personal level, what does this mean to you, given the year that you've had?
He'll be having happy time when he gets back.
So I think why don't we do the questions about immunity?
The vaccines have come to us with the most amazing speed, given that this is a new organism that this time last year very few of us knew very much about at all. Mm-hmm. So it's an absolute triumph of science that they have come that fast. But vaccines are always best deployed before there is an epidemic or an outbreak. If you look at the MMR vaccine, for example, for children, the whole point of it is to stop there being measles outbreaks through high routine uptake. But in this situation of a new emerging disease, you don't have that luxury. You have to go with the vaccine as fast and as broad as you can, as soon as you get it. Yep. And that is literally the best you can do. There will always be, unfortunately, people who have been exposed to an infectious disease who are then vaccinated but are not vaccinated in time for the disease, for the vaccine to have had the required effect to give them immunity before the disease takes hold.
I think
that
we
is
should
always
get
going
the
to be the
guy
case.
doing the
and potentially there will be more of those patients.
And signals. How many people has he
situation
injected
where the
tonight
disease
already?
levels are very high compared to when they are very low. But it is just a biological fact that you can't make a vaccine work faster than its design gives it the capability to do.
Again.
And typically, antibodies begin to rise at the 7 to 10 day mark. But it's really 14 to 21 days before you see a kind of solid and sustained antibody response.
Like in a couple of minutes.
But all vaccines vary, and all human beings vary in terms of the profile of their antibody
did too then.
response
See that?
at a
Very quick.
level. Thank you very much.
Thanks
and again,
very much. Well, just on
you could vaccinate the whole population in half an hour.
How I feel about it, Richard,
That's a bit rude.
It's very frustrating, obviously, that we're in a situation where we've got a new strain of the virus surging in the UK now in many parts of the UK, not all of it, but many parts of it, and that's necessitated these tough measures that we're taking, with the knock-on impact, alas, now for schools in the areas most badly affected, and yet I'm also filled with hope by the arrival of this new British-made vaccine. It really is potentially a real cause for optimism around the world, because this Oxford AstraZeneca vaccine, because it can be delivered at room temperature, doesn't have the logistical challenges of the of other vaccines which need to be kept refrigerated at -70. I think it can get to places that can't currently be reached, and offers real hope across the world in fighting this pandemic. So I suppose my emotions at the moment are a mixture of frustration plus optimism equals whatever, grim determination or something like that. But we will get through it. I've absolutely no doubt. But we've got conflicting currents at the moment. Let's go lastly to Charlie Cooper of Politico.
Politico, never heard of them.
Thank you for having me. It's tremendous news, of course, about the Oxford vaccine, and you've introduced stringent new measures.
That's a room, isn't it?
Really concerning figures that Professor Van Tam showed us. But given we're now so close to a moment where vaccines change the situation we're in, what is the rationale behind sticking with the tier system rather than going for what many scientists say we should now do, which is go for a full national lockdown until such a time as vaccines, as there are enough vaccines to protect the vulnerable? And a question for Professor Van Tam: what is our latest?
I think it's going rather well.
Understanding
okay,
of,
Boris.
Whether the new variant will be, whether the vaccine will be as effective against the new variant?
Yeah, well, thanks, Charlie. Look, I'm not going to hide it from you. That obviously was an option that we considered intensively, but on the whole, we thought, given the uncertainties that we still face, the impact of the tier 4, which is still a bit of an open question, it would be fair to say, and you saw the evidence of how tier 3 was working on, at least on the old variant. We thought it right to continue with the tiering, particularly since you still have quite a regional differentiation.
Yeah, but the problem you've got is Liverpool is in tier 3, all around it is tier 4. Everyone from tier 4 is going to go to Liverpool. Liverpool will end up in tier 4. People are going to die in Liverpool. If we went in lockdown, wouldn't die now.
But we're going to keep.
We need a national lockdown.
Both for
pointless
for all parts of the country.
Sorry, Boris.
So on the point about the strains and the vaccines, it's a good question. There is, of course, the UK strain, and there is, of course, the South African strain, both of which have been in the news around the world. And both of those viruses, as I understand it, are either in or heading on their way to Porton Down to be assessed by the expert virologists to check that the AstraZeneca vaccine will still be effective. And I understand from my colleagues at Pfizer that they are also conducting very similar experiments to again check on both of those strains in relation to the Pfizer vaccine. That isn't, unfortunately, work that takes 12 hours in the lab. It takes more like 12 to 14 days, because you have to take the virus and grow it up live, and then you have to run it against the sera. So it will be a few more days, potentially a couple of weeks, before our scientists can give us a solid steer on that. But there are two pieces in the background that I think are very reassuring. The first is that there is work now underway by scientific groups around the world looking at a whole range of variant strains, and they are showing that by and large the neutralization is quite cross-reactive. In other words, the vaccines will cover quite a large range of variants. The other thing is about the vaccines themselves. They don't just produce a very single type of antibody, in other words, one very precise, unique flavour, if you like. They actually create a kind of soup of antibodies of multiple different flavours, and that means that if one fails, there are more behind it that are still going to bind to the virus. And so you would need really very, very substantial mutations indeed to completely outwit these vaccines altogether. So if we were into a situation where there was an effect, I would expect it to be a marginal degradation rather than a kind of, we've lost the lot kind of scenario. I hope that helps and gives you a bit of reassurance, but the proper data is about 2 weeks away, I think.
Thanks, James. Do you have anything to add?
Nothing to add on that, Prime Minister, but maybe if I could just, I'd started by thanking NHS staff, and perhaps I could finish by, on behalf of the NHS, thanking the public for the response they've all made to social distancing measures this year, because that has really helped the NHS cope. It continues to help the NHS cope, and I'm sure my colleagues throughout the NHS, and indeed should thank all key workers, but across the NHS would want to join me in thanking everybody for complying with the measures and ensuring that we take pressure off the NHS.
Thanks very much. Well, what he said, folks, I totally agree with Steve and with JVT, what they've said, particularly about New Year's Eve celebrations tomorrow. Please let's celebrate sensibly, so in a way so as not to spread the disease. Thanks, everybody. Thank you.
Thank you. I wonder when the broadcast finishes. Oh, a bit of a Dell then, I think. I think we're going to go into a bit of a Dell then. So yeah, I mean, on the plus side, we're not getting a warning. We are closed as on non-essential retail. And we are in Tier 4 from midnight or 5 o'clock in the morning, whatever the hell it is. And that's the right thing to do, rather than say we're going to do it on Monday or we're going to do it next Wednesday or whatever, and then everyone panics and buys toilet roll and God knows what else. So well done for that. Oh, we've got Boris back on again.
And their waters, and to leave the European
Union. What's he waffling about this time?
Earlier this year, we fulfilled that promise in that we left on January the 31st with that oven-ready deal. Since that time, we've been getting on with our agenda.
Yeah, everyone said about what happened to that oven-ready deal. The oven-ready deal was starting Brexit. It wasn't actually doing the negotiation, because we weren't allowed to do the negotiation, weirdly, until we started Brexit, which made no sense. But anyway. So yeah, thank you for watching, etc. But yeah, as a summary, should be national, because the regions that are in Tier 3 are going to get inundated by people illegally travelling from Tier 4 to them, which is going to put them in Tier 4 anyway. So it should be national. Let's save lives of people that can be saved. It should be at least a month minimum, but I think 6 weeks to 8 weeks to give chance to keep the NHS going for people who need, like he said, cancer treatments, or people who break their arms, legs, slips, trips, falls, have heart attacks, strokes, which is my age group, and other things like that. We need to keep the hospitals free of people. In the meantime, people are getting vaccinated. Obviously, that won't make any effect really until middle of the summer, when we get enough vaccines to vaccinate a majority of the people who need the vaccinations. But by the time we get to next autumn, when it'll start picking up again, because we're all inside, hopefully the vulnerable will not be ending up getting the COVID, getting ill, getting in hospital and dying. The rest of us can keep our face masks on, we can keep our space, we can wash our hands and do all that for, well, 2, 3, 4 years whilst this thing dies down. And then when we get COVID-20, which is probably on its way anyway, at least we know what to do. As for the NHS Nightingale hospitals, they're on about we can't find enough skilled medical workers to work in them. Well, why don't you put the people who have had an operation for anything else, like a hip replacement or a knee replacement, and they're out of the danger time, why not move them to the Nightingales and just have standard nurses and carers looking after them, where they don't need as much attention, and then that frees up beds in the main hospital for other people who've had accidents or need operations, and COVID patients as well. And then, all being well, keep the thing in control, and this will be the last lockdown. Probably. Don't quote me on that. Although I have been right, everything I've said so far, even though people disagree with what I say, it's all happened so far. So yeah, let's wait and see what happens. So, thank you very much for watching. T-Bone Jr., Penny Sherratts, DC number 9, Tufts TV, Mannering. Oh no, Boris Johnson, sorry. I just saw a name and said it. Don't forget to like if you enjoyed this and my take on this thing. Stay safe. Stay within the rules, best you can. Don't let us lose it all now. That's all I'm saying. We've come so far, and we definitely need to get this thing kicked off. Otherwise, we'll be in lockdowns on and off forever. So we need to. This is the last one. Do it right. If we're gonna do it right. Right, do it with me, kind of thing. But not literally do it with me. That'd be weird. Oh God, millions of levels. Jesus, yeah, I forget I said that. Thanks for Boris for chipping in as well. I mean, he was a very busy man, and he's still come up with comments, which is good. Good to see. And that'll be it for now, until the next briefing for this part. But obviously there's loads of other stuff coming up on the channel, including retro gaming, current gaming, Fall Guys, drinking, reviews, cooking, loads of stuff. So until then, see you everyone. I'll be seeing you.